You're listening to Health Professional Radio. My name is Wayne Bucklar, and joining me today is Dr. Stewart Washer. Dr. Washer is the Executive Director of listed medical cannabis research company Zelda Therapeutics. He joins us today to talk about Medicinal Cannabis 101. Stewart, welcome to the program.
Thanks, Wayne. Yes, medical or medicinal cannabis, I think it's all the same. I interchange them. But no, thanks for having me, Wayne. It's an interesting time in the cannabis field, as you and the listeners would realise. We've got legalisation of medicinal cannabis now in Australia, and which is exciting. But of course, none of the doctors have been trained at medical school on what cannabis medical use is. They've only been given cannabis as a nasty thing that they should tell their patients to stop taking. So we're really hitting the ground running, trying to do the proper clinical trials and train doctors out there and get them comfortable with cannabis.
Now, it's interesting for me, at least, in the media industry, when I take this story, which has got cannabis in its title, and try and publish it on social media, a number of the social media channels will reject it because it's about an illegal drug. Even though it's been legalised, there's still that significant stigma about it, isn't there?
Absolutely. Well, the weird thing there, Wayne, is actually in the United States, they've been using it for over 5 years medically in California and other states, but it's still illegal at federal government level in the United States. So Australia and Canada are two of the first countries to legalise it at federal government level. So it's a big step forward.
I recently interviewed an accountancy firm in a state in the US that legalised the sale of cannabis, and the reason that she was being interviewed, the interesting thing was that the business can't open a bank account because that's under federal law and it's illegal under federal law, but they can sell cannabis in the state. That's legal. So she has this role where people bring her in basically a suitcase full of money, which she has to bank on their behalf and pay bills on their behalf, because even though it's a legitimate business in that state, because of the federal law, they can't open a bank account.
Absolutely, it's absolutely crazy, Wayne. What we're seeing is, the United States has led the way, really at state level, but federal government level, I think Australia's far better. So what we really need now is the doctors to get on side and learn a little bit about this, because of course it's all right for a doctor to say, look, I've done my research on medical cannabis and decided this is not for you, for whatever medical reason. That's perfectly legitimate, but it's not legitimate for a doctor to say, look, I don't know anything about it, so this is not for you. So we're really saying to doctors that they have to now learn about this. The endocannabinoid system's an old receptor system that sits in the human body, and right back to every vertebrate, and even sea sponges have an endocannabinoid system. So it's an inherent system in the body where there is actually cannabinoids that exist in the human body that bind these receptors. And these are just plant-based cannabinoids from the cannabis plants, which happen to bind those same receptors and do all the good things.
Now, to be clear, in Australia, we're not talking about anyone selling a plastic bag full of green leafy material.
No. Well, I'm sure that'll always go on, but no, that's not the stuff we're looking at for the medical use. Ours will be well-validated oils, and either administered as an oil under the tongue, or a gel capsule for pain, chronic pain, or a vaporization of that oil as well, but never, cannabis dried flower that people will be smoking. That'll never be for medical use. That'll stay well within the recreational market. And quite a different variety we use here as well. We use quite different strains for the recreational market.
And Stewart, do you envisage this being capsules that are available at the pharmacist? Is that the path that we'll go down?
Absolutely, yep. It'll always require a doctor's script.
Yep.
And initially from an authorised prescriber, or SAS, Special Access Scheme B, because it's not a registered medicine. But then you'll just go down to the pharmacy and fill your script. They'll open up the safe, and where they store the opiate drugs, Schedule 8 drugs, this cannabis medicine will be stored alongside.
And the education of GPs is, I guess, going to be an ongoing process, and really will rely on GPs wanting to be educated as much as anything, I suspect.
Look, very much so, Wayne. I mean, the problem is the Australian Medical Association has come out at certain levels and just said, we don't want to hear about this and, this is dangerous, which I don't find acceptable as a scientist, and clinicians that really are out there are trying to look at alternatives for patients. The opiates for pain control work in some cases, but in other cases they give severe side effects and even death, as you'd realise in respiratory failure, and they don't work very well for neuropathic pain, and some of these other nerve-based pains. So really, the cannabis medicines seem to work very well alongside the opiates, and you can use a lower dose of opiates or remove the opiate completely.
Now, Stewart, I've been doing my very limited research here and just having a look at some of the conditions that seem to have been well treated overseas. I wonder if you could comment on things like autism and epilepsy and insomnia.
Yeah, look, thanks, Ryan. Great. For Zelda Therapeutics, what we're looking at is areas which aren't clinically validated. So there's evidence out there in insomnia and eczema and autism that cannabis medicines help from Canada and Chile and the United States. But really more clinical trials are needed, and that's exactly what Zelda is doing. So in the insomnia side, we're really looking for something that can give people a good night's sleep and they wake up feeling refreshed so that they've had their proper REM sleep and slow wave sleep. So we're doing a clinical trial here in Australia and one in Chile where we'll be measuring people with brainwave monitoring when they're on the medicinal cannabis, and it'll be a placebo-controlled trial as well, so they won't have a placebo effect. We'll look at that and control the trial properly. And in the eczema side, it's a topical we're looking at. It's got a good anti-inflammatory basis, and eczema, as you know, is a big problem out there. So we'll be doing that trial very soon in Chile as well. And an autism trial we're looking at in Chile as well, where autism has been treated very well, where this violence and severe anxiety that autistic children get has been treated with this, and it doesn't drug them out. They're not high or anything. They're actually at a much lower cannabis level than that, but it really calms them down and makes them quite alert and interactive, so they can learn and develop properly.
They're interesting examples, and I guess there is no quick way to do clinical trials. How long do you expect before you'd see results from that?
So what we'll be doing, we'll be starting those clinical trials later this year, November, December, hopefully. And it'll take about 6 months to run those trials. They're not big trials. They'll have, tens of patients, not hundreds of patients, because they're small phase 2 trials. And then probably another 3 months to analyse. So we'd expect results before the end of next calendar year. And that'll let doctors start writing scripts out for those products, because under the authorised prescriber model, you just have to show clinical evidence of use. Yes,
and there will be some patients for whom that will be life-changing, I suspect. Stewart, it's been a pleasure having you with us once again. Stewart, it certainly sounds promising, and 12 months is not too long to wait. For people who have heard you today and are interested in getting in touch with you, or, for that matter, who are clinicians and who are looking for further evidence, is there a website where they can reach out?
Yeah, absolutely, Wayne. So it's www.zeldatherapeutics, as one word, .com. And my email address and phone numbers on the Zelda announcements as well on the ASX. So please feel free to contact me anytime that anyone's interested.
So that's Zelda Therapeutics, Z or Z if you're an American, ZELDA Therapeutics, and you can find all the details in those places. If you've missed my conversation today with Dr. Stewart Washer, Executive Director of Zelda Therapeutics, the good news is we have an archive on our website that contains both the transcript and the audio archive. You can access the sound at SoundCloud, or you can access the transcript at www.hpr.fm. You're listening to Health Professional Radio. This is Wayne Bucklar.